Good afternoon. I'm Dr. Natasha Gallant. I'm an assistant professor in clinical psychology at the University of Regina, which is located in Canada. Today I'll be presenting my team's protocol for a project supported by Healthcare Excellence Canada and funded by the Canadian Institutes of Health Research and the Saskatchewan Health Research Foundation. Before I delve into the details of our team's project, let's begin with some context. In Canadian long-term care homes, unpaid caregivers such as family caregivers and volunteers often provide essential care to long-term care residents. For example, volunteers may provide residents with social interaction and an opportunity to communicate with others. Beyond opportunities for socialization, family caregivers may assist their loved ones with feeding, mobility, or assistance in decision-making. Despite the crucial role of unpaid caregivers to the well-being of residents living in long-term care homes, supports for unpaid caregivers as essential partners in care have been largely overlooked in Canada's response to the COVID-19 pandemic. More specifically, during the first wave of COVID-19, in-person visits from unpaid caregivers were banned across most of the country. This response abruptly and dramatically restricted access to informal supports that residents typically received from family caregivers, volunteers, and so on. On the surface, it might make sense to restrict the amount and type of access that unpaid caregivers have to long-term care homes in the midst of a pandemic. However, when we take a closer look, restricting access to long-term care homes has and continues to have a significant impact on the well-being of their residents, unpaid caregivers, and staff. A few examples of these adverse consequences for residents that have been reported include increased rates of social isolation, loneliness, depression, and hopelessness. Since jurisdictional legislation regarding access for unpaid caregivers during crises such as the COVID-19 pandemic does not exist or is not uniformly applied across jurisdictions, Healthcare Excellence Canada published a guidance document with recommendations for the safe reintegration of unpaid caregivers into long-term care homes during the COVID-19 pandemic. Using the Consolidated Framework for Implementation Research as a backdrop for our project, these recommendations from Healthcare Excellence Canada form the basis of our proposed intervention. As we can see at the bottom right side of my poster, the guidance document included 7 recommendations around providing education on the role of unpaid caregivers, as well as protocols for screening and infection prevention and control with unpaid caregivers. With each of our 3 long-term care sites, we are holding regular standing committee meetings over Zoom. During these meetings, we are adapting our intervention to the needs of that specific site by consulting with a group of residents, unpaid caregivers, and staff. We will then use a rapid cycle quality improvement strategy to implement this intervention in a way that allows for continuous improvement of that intervention. To evaluate it, our project is comprised of a non-randomized controlled before and after study design. We're using a mixed methods approach where we will triangulate data from questionnaires, interviews, and focus groups completed by residents, unpaid caregivers, and staff both before and after the intervention is implemented. We expect that residents will report decreased loneliness and increased social support, that unpaid caregivers will report increased involvement in the care of residents, and that staff will report decreased burnout and moral distress. If results show our intervention to be beneficial, we hope to share a protocol with other long-term care homes across Canadian jurisdictions. We also plan to use an integrated knowledge translation strategy that will allow us to improve visitation policies across jurisdictions.